think that's the ultimate thing. People just feel like their lives aren't valuable. And so that part of me is like, no, your life does matter. And I would really love people to walk alongside the people who are struggling.
Hello, all. My name is David Craig. I am filling in for Leon today on Return to Reason. Today's guest will be speaking to an issue that provokes a wide range of emotions, and that is medical assistance in dying, also known as MAiD. In June 2016, Parliament passed Bill C-14. MAiD is now enshrined in the law of our land. Anyone who could show that their death was reasonably foreseeable was eligible. And stats show us that MAiD deaths, they've increased now every year, and they now account for actually about 5% of deaths across the province. Here to discuss the dichotomy of choosing an easy death over a difficult life is the executive director of an organization called Life Culture.
Today, a special episode of Return to Reason, where knowledge and wisdom intersect.
Susan Penner, it's so great to have you on the show.
Thanks so much for having me. I'm so happy to be here.
Now, would you tell me a little bit about what's happening in Canada right now, and specifically what exactly is MAiD, if people do not understand or know really what's happening in our country?
Okay, well, MAiD stands for Medical Assistance in Dying, and it is the Canadian legislation that allows physicians, nurses, nurse practitioners specifically, and pharmacists to carry out euthanasia and assisted suicide. So it seeks to allow eligible participants to have a death with dignity. That's a common phrase, death with dignity. But actually, it directly threatens the belief that every life, no matter age or ability, is worth protection, care, and respect. Euthanasia specifically is the direct administration of a substance that causes death, such as an injection of a drug. So this would be administered by a physician or a nurse practitioner, whereas assisted suicide is a provision or prescription of a drug that the eligible person takes themselves in order to bring about their own death.
Now, from my understanding, what I've been learning these last number of days is that Canada has become a leader in this area in the world. And there's other countries that are pretty open with this as well. But is that true? Has Canada become a leader? And how much have we actually increased? It seems like there's an exponential increase happening over the last couple of years when it comes to MAiD.
Yeah, absolutely. I was in a meeting earlier this week with some other pro-life leaders, and it's interesting. Countries around the world are looking at implementing MAiD, but they're looking at Canada as how not to do it, because we've become the most permissive around the world when it comes to medical assistance in dying. For some perspective, if you look at the state of California, they implemented MAiD the same year Canada did, 2016. And last year in 2021, California had 486 deaths by MAiD. Canada had 10,064. And we have the same population, implemented the same year. So that just kind of gives perspective into how out of control MAiD is in Canada.
Now, that change in numbers, would that be because of our system is very loose in terms of allowing, the criteria seems to be pretty low to get through? Is there other reasons that add to that, or?
Yeah, primarily in California, or even in a lot of other jurisdictions in the world, death has to be imminent. You have to be dying within 6 months, I think is California's parameter there. And they don't offer MAiD. So a patient would have to request it. So where in Canada, there are no parameters really. Your death does not have to be foreseeable. And also physicians are allowed to bring up MAiD, and often even recommended that they bring up MAiD to patients. So it just shows how important safeguards is and how safeguards are and how they actually impact numbers.
Okay, so let me ask you this then. Well, let's back up just a tiny bit. Who can apply right now in Canada for MAiD? How wide are those goalposts for people?
Okay, so in Canada right now, you have to be 18 and you have to have a serious illness, disease, or disability that cannot be reversed or relieved to a level of comfort that's acceptable to you. You do not need to have a fatal or terminal condition to be eligible for medical assistance in dying. Further, in March, patients with mental illness will be eligible for MAiD. But the thing is, we hear those parameters, but we're actually starting to see cases of when people are poor or disabled and they don't have access to proper resources being eligible for MAiD now.
Mm-hmm. So who approves people to be able to move ahead with being medically assisted in dying? Is it a panel on the board, or is it a physician or a couple physicians?
Yeah, well, first of all, there's kind of, I'll say maybe a two-track system in Canada. So if your death is not foreseeable, there's a 90-day waiting period that you apply, and there's a 90-day waiting period. However, if your death is foreseeable, there is no waiting period, no 90 days. So even if you think of somebody who might be terminally ill and they're having a bad day, presumably they could request MAiD and theoretically get it that same day. Yeah, so there's kind of this two-track system. So primarily it's between the physician and the patient. So in terms of, even having an objective witness to say, yes, this is okay, there's organizations or people who are willing to approve that aren't even necessarily family, for example. So there'd be loopholes, I would say. If you want it, you can make yourself eligible.
And Canada seems to be the place that you're most likely to do that.
Yeah.
With so just to play devil's advocate slightly, so some people on the other side, maybe a lot of people would say, well, there are people who are living with serious, severe pain, no quality of life. Why wouldn't we want to help them with, as you mentioned earlier, dignity in death, that stating? What would your answer be to someone like that who is actually in a situation where, man, they've got very low quality of life, and maybe death isn't imminent, but they might be a couple years away?
I would say we should be working towards dignity in life, not dignity in death necessarily. So if you look at Canada, only 30% of people have access to proper palliative care. And by palliative care, I don't just mean like for older people. Yeah. Palliative care. So if only 30% of people have access to, let's say, proper supports, proper pain medication, is it really a choice that we're giving them? It's either to suffer or to die. I think we should be investing more in things, let's say, like physicians who are specialists in pain, because 90% of pain can be managed if it's treated properly. So I think we are jumping ahead too soon without looking at other things we can do to actually help people have dignity in life.
In conversations that you've had with physicians and people who've been in the industry or currently are, doctors and physicians and everyone in the medical field, they're taking oaths to help preserve life, help with patients. What are physicians saying that you've encountered? Do people have a problem with this? If they do have a problem with helping and assisting, are they able to refuse? What are physicians saying in regards to this and where Canada's going with MAiD?
Okay, there's a couple of questions there, so I'll try and address them in this. So doctors who oppose MAiD believe they have a moral obligation to help people live, which is traditionally what we've expected from doctors. This does not mean disproportionate medical intervention, though. Our medical technology is so advanced. There are times when it is okay to let somebody die naturally, but that's very different than an intentional lethal injection, I'll say. Mm-hmm. These doctors, they took an oath to help people live, not to die. So MAiD is really going against, their morals and what they wanted to do as doctors. However, on the other side, if you look at a document produced by Canada's providers of medical assistance in dying, the document states that doctors have a professional obligation to bring up MAiD as an option when it's medically relevant and the person is likely eligible as a part of the informed consent process. So you really have, quite a wide range of doctors now when it comes to, I guess I'll say, the sanctity of life and the value of suffering, those types of things. So there's no clear, there's different doctors. When it comes to conscious rights protection, Manitoba is the only province that formally has conscious rights protections for doctors who don't want to participate, but no other province has that.
It's interesting looking at issues, especially in the last 5, 6, 7 years in Canada, where things you used to think were lines in the sand that you can't cross, like you mentioned, sanctity of life, seem to be on a very slippery slope. And Leon on Return to Reason's often said, we got to play the movie out to see what's going to happen if you can foresee 5, 10, 15, 20 years down the road. And with what you guys are trying to do at Life Culture, what are you trying to, if you can play the movie out, where do you see this going, the direction of Canada when it comes to MAiD right now?
Well, I don't use the term slippery slope very often, but I would
Yeah.
actually say MAiD is probably a very good example of slippery slope. So when it was initially introduced in 2016, it's framed as, somebody who's suffering and is going to die very soon anyways.
Yeah.
So that's how it initially got implemented in 2016. Then in 2021, it was radically, the parameters were reduced. So it's really accessible to anyone who is suffering at any level. And then like I say, in March, now it's going to be for people with mental illness.
Yeah.
The greater issue, or the root issue, or what I'm seeing, is just this increasingly, I'll say, materialistic worldview, and that life is just matter, of no eternal significance. So whether we live or die doesn't actually matter. And I think it speaks to a certain degree to the lack of hope in our country. Whereas people, a lot of people feel they really have nothing to live for. What's interesting, if you look at the parliamentary report on medical assistance in dying, the primary reason people are choosing it isn't because of pain or suffering. It's because they've lost the ability to do things that give their life meaning, or it's from loneliness or isolation, or not wanting to be a burden. So it's interesting. It's being framed as, this medical relief, but it's actually more social, spiritual, emotional, that is causing people to ultimately choose medical assistance in dying. And those are things we should be able to overcome as a culture.
You mentioned when you're just talking about in 2021, after it's introduced in 2016 and determined it's a constitutional right for people to be able to have access to this. In 2021, the parameters were radically reduced. Can you explain why they were? What was the reasoning behind that? From obviously our government who is pushing that.
Yeah, I would say there's a couple of things. Politically, talking about autonomy, everybody wants autonomy, and that's why we're doing this. People should have autonomy. The challenge with the autonomy argument is that you're actually forcing, let's say, doctors or other people to get on board with something they might not be comfortable with. But the other part of autonomy is true autonomy, you can take your own life. You don't need permission from the government to take your own life, right? To commit suicide.
Yeah.
So it is interesting. On the one hand, we talk about autonomy, but people already have autonomy to make that decision. This is just, softening it and making it acceptable. Yeah, so that would be one of the main things I'm seeing. But the other piece of that would be the savings to the healthcare system. Yeah. Quite frankly, in a universal healthcare system that just can't keep up, medical assistance in dying provides a huge healthcare savings. So it might be framed as autonomy and compassion, but I think the root of it is actually financial, at least in how aggressive Canada is being, for sure.
Interesting. It's interesting looking at any argument where euphemisms are involved to soften words. Is that for me right off the hop is a huge indicator that there's major flaws in terms of what you're trying to purport and to get out there, and utilizing MAiD and using terms that are going to make people feel like it's a good thing. You're really just covering up what it really is at the end of the day. So what would be life culture's message and over the next while trying to educate Canadians? If you had a massive megaphone that all 30 million people in Canada, 35 million people are listening to, what would you try to let them know when it comes to MAiD?
Oh, I would just want to let people know that your life has value. I think that's the ultimate thing. People just feel like their lives aren't valuable. And so that part of me is like, no, your life does matter. And I would really love people to walk alongside the people who are struggling. So when it comes to MAiD, we hear things like compassion and mercy. It's a compassionate thing to do, but the Latin root of the word compassion means to suffer with. To have compassion is to walk along somebody who is suffering, not take out the person who is suffering. Yeah. So I think we just need to reframe, our perspective. Unfortunately, life does have suffering. We all know that. But having said that, in that suffering, a lot of good can come from that. Not just for our own personal journeys, but even for the people around us that see how we handle it and what we can bring to the table in our suffering. So I think those are kinds of, life has value, and there's going to be people who can walk with you
Yeah,
through that.
well said. So if you had your way, would you scrap the MAiD program entirely, or would you have it extremely tight parameters to where there are certain people that are eligible to be able to
Well,
walk through?
right. For me personally, I do not support MAiD.
Yeah.
Having said that, I don't think there's any going back in our country right now. So what I'd really like to see is them to pull back on the parameters again. However, even with mental illness restrictions loosening, there's many organizations, from people with disabilities, from mental health organizations, who are opposed to this expansion of MAiD. However, the government's still moving ahead with it. So a lot of flags and concerns have been raised, but this just seems to be the track we're on. I would hope as time goes on, when we see the consequences of this, maybe governments would start tightening again to where it was limited to people who are, suffering greatly
Yeah.
and going to be dying soon. But that's from the government perspective. From my perspective, I don't support MAiD.
Right now, with the way the system is, does someone who has a mental illness, who might also not be thinking clearly, they seem to have the ability to go through with something like this when maybe their quality of life isn't compared to what the original status was. Can you comment on that? What's happening when it comes to people who are mentally ill?
Yeah, I mean, obviously it hasn't been implemented yet, but in terms of, I'll give you an example. I got a phone call from somebody I actually know personally, and she told me that if MAiD for mental illness had been available 5 years ago, she for sure would have taken MAiD. She was really depressed, really struggling. And she said 5 years later now, she has two grandkids. Her life is just wonderful. And she looks back to think of how close she was to taking her life. And she just said, like, people at their lowest time or in their deepest depression should not be able to make this decision. And that is not to minimize what people with mental illness are dealing with on a day-to-day basis. I know it's really, really difficult, and it's really difficult, can be really difficult to treat in terms of finding the right treatment. Having said that, again, the goal is to remove the suffering, not the person who is suffering, right? So I think here too, greater efforts need to be made to treat people. One of the challenges too is we have such a hyper individualistic culture. And I think we're seeing, really, when it comes to both things like abortion and MAiD, I think we're seeing the outcome of that, where we're not living in community as much as we used to. We don't care about other people as much as we used to. So I think that's some of the, underlying ground framework as well, right? In an individualistic culture, we're not caring about others maybe as much as we should.
Yeah, that's an interesting point. You even throw in the word compassion, that they're using the word compassion and dignity to help people die. And we could even make an argument that it's actually the opposite right now. It seems like it might be the easy road out. Yeah. Compassion would be able to take these people by the hand and walk with them, help them have the best quality of life, to actually be there as a human being, to walk the end of their life out, or however long they have left to live. That to me seems like real, true compassion, and that's tough and that's hard to do. Mm-hmm. Yeah, I'm sure, like yourself, I've known people and seen people pass and had to see them go through that tough time, but being beside them also is some of the most rewarding times of my life. I can say that truly, being a part of that process with them. But there's a lot of people who are going to be watching this program. Canadians, how can they be a part of the conversation? If they've got concerns, maybe a red flag has just jumped up because of the things you've been saying, and they're like, I want to be able to speak up. I want to have a part of this conversation. What would you urge them to do? How can they act? How can they make their voice heard? Is there places they need to go to learn more?
Yeah, the approach I would take is just really to encourage people, first of all, to become equipped themselves. Read the reports, read the numbers. So often we're fed stuff on social media or in the media, and we take it at face value. But if you actually dig a little deeper, there's more to the story. So I think people personally need to be equipped on it. Of course, we can always email and get in contact with our government officials, that type of thing. But I think we need to be equipped. So even at the grassroots level in these personal conversations, I think sometimes we focus too much on, or we spend all our energy. Now we're going to get in touch with the government on this. We're going to email our MPs. And I think we sometimes lose sight of, what about the conversations around us? And MAiD is, most people now in the next 10, 20 years, we'll know somebody who's made that choice. So I think we need to be very careful also in how we address things, again, whether it's abortion or MAiD, to be sensitive to the fact that these things are increasingly common. And know how to have these conversations one-on-one with people as well, not just on social media or not just on the government level. The other thing I would love to see is more churches talk about the sanctity of life, abortion, and MAiD, because since Roe v. Wade was overturned, I've really realized that a lot of Christians aren't even equipped in these areas. So if the church and if Christians aren't equipped, how would we expect even broader culture to be equipped? So those are kind of some of my recommendations.
It's a great point. I believe issues in our country are decided over the dinner table. And a lot of times, actually probably more often than not now, these conversations aren't being had around the dinner table for whatever reasons. Life is busy, other things are priorities, whatever. But when people are educated and start diving into issues and not being afraid to have these conversations with people who may or may not disagree, that's really when the national conversation can start to go. So that's a great thought. I would just encourage people who are watching, if this is interesting to you or you have a passion or generally you believe the sanctity of life like you and I both do, is start educating so you can have those conversations with people around you. They're tough conversations to have, but they're also extremely valuable. And that's how we become better as a nation and as citizens.
Yeah. And, when we're equipped, then we're less defensive as well. I think that's important because our culture, like we're told not to judge, and our culture is very polarized. So I can see where people are a little guarded when it comes to this. But, when you're equipped and can just stay cool and calm and have some of these discussions, it can go a long way.
Yeah. There's an interesting quote that I believe psychiatrist Mark Conrad mentioned, talking about assisted suicide as being sold as healthcare. Seems obviously very contradictory of each other. And he said if you replaced basically the needle or the pill with a gun, it would paint the picture differently. This alludes to what I was saying to earlier about euphemisms in the arguments. Now, that being said, leading to my question is, right now with doctors, have there been, are you aware of any cases of doctors who have not wanted to go ahead, or let's say if they've had a client or a person say, I want to move ahead with MAiD, and a doctor does not want to go ahead with it? Is there any repercussions for that doctor at this point?
Yeah, that would be a provincial to provincial situation. And I'm not sure actually what, let's say, from province to province, what they require specifically. Some may require that even if the doctor doesn't want to do it, they may be required to recommend another doctor who is willing to do it. And I think this conversation, I think, is really evolving because we're still we're early days really when it comes to the MAiD conversation, particularly now that the parameters have been expanded. So I think we're going to have to wait that out a little bit and till we start hearing from more physicians. And the fact is, I think it is relatively easy to find a physician that is willing.
Yeah.
So even if your own doctor doesn't want to do it, there are ways you can find somebody who does.
So this is very much becoming a commonplace in Canada, and that's the direction it's moved. Now, to bring politics into it a little bit, this is a political issue, but in 2016, when this started, and 2021 as it continued to grow, do you know, and this you might not know this, but regarding our political parties, was this purported by one political party, or were all political parties on board with this? Was there a lot of pushback? Do you remember how that went down?
Well, in terms of it, maybe I'll say being political, campaigning on helping people die isn't exactly a great campaign platform. So I don't know that any party would initially, at least, would have made it a part of their campaign to get elected. So it's not really so much to gain public support, because I think ultimately people would say, Canadians would probably say, well, yes, we support it, but we believe there should be some parameters. I think that would probably be general, although now the autonomy argument keeps coming up more and more.
Yeah.
So in terms of it political that way, I'm not sure that
Okay.
it's a political move. I think it's more in terms of healthcare savings, to be honest, is where we're looking to save money in the healthcare system. And this makes sense, right? However, like you said, with euphemisms, it's framed as compassion.
Yeah.
Unlike with abortion, let's say if you're part of the Liberal Party, you can't be an MP that is pro-life if you're
Yeah.
part of the Liberal Party. I don't know that any of the parties have taken that position. I think it is still an MP to MP. There's conservative MPs who have, tried to bring up private member bills on this. They always lose on the floor. But right now, I think it's still probably MP to MP within each party.
Yeah, that's good. Now with Life Culture, how can our audience support what you're doing? Where can they go find out more about what Susan's been up to, things that you've been involved with, but also Life Culture? I want to send people to you to show them basically everything you guys have been involved with. Tell us about Life Culture and how they can help you.
Wonderful. Well, you can always find out more information at our website, which is lifeculture.ca. But again, we take the approach of providing life-affirming teaching and then also practically helping women. So let's say life-affirming teaching would be going to schools or youth groups or doing pastors' lunches, speaking at various events, just, on life and the value of life. But we also have the practical support for women. So we're not pregnancy crisis in terms of providing counseling, but we do help women, whether it's with pregnancy or domestic situation. There's a variety of issues that have come up where we support them financially to help make their circumstances better. We also have something called Angel Baby, which is pregnancy and infant loss support. So there's a lot of things going on, but they're on our website at lifeculture.ca.
Awesome. Great. Well, we'll make sure that we send people over to see what you're doing. Thank you so much for your time. Susan, really appreciate it. Looking forward to hopefully having you on again. All the best.
Thank you so much. I really appreciate it as well.
Thanks for watching Return to Reason. I'd like to read your thoughts in the comments section below and pay it forward. Share this video with someone. Hit subscribe and tap the bell icon so that you're notified every time I post a new video.